If you have dogs or cats, you probably think you're being a good owner by making sure they get their shots each year. But there is a growing movement to change that. Many vets now say animals have been getting too many shots too often, and it could end up costing some pets their lives.
High five. Very, very good. What a
When Sherry Crispin adopted Mollie Mae, she thought she'd found the perfect pet.
Just a delightful year-and-a-half-old dog, you know, who was just absolutely beautiful.
But within a few months, something strange started to happen.
So she first started getting a few weird little bumps on the inside of her ear that I didn't think would be normal. And then she got a pretty big sore on the back of her neck.
So she took her to several vets, but no one could tell her why the sores kept spreading.
You know, toward the end, she wouldn't even get out of her bed. I had to, you know, feed her from my hand. I mean, if you looked at her, she looked like a leopard. She had so many sores all over her body, and I just couldn't find a vet that knew what it was.
Then finally, a specialist figured out Mollie Mae's problem, an autoimmune skin disease. Essentially, the dog's body was destroying its own skin.
Well, it broke my heart, you know.
Crispin now thinks she knows what triggered it all, a cocktail of more than 5 vaccines given to Mollie Mae just before her adoption. A vaccination she believes overwhelmed and confused Mollie Mae's immune system, causing the potentially deadly disease. It is a theory that's getting a lot of attention among vets.
No pinches, no pokes.
After decades of telling pet owners to have animals vaccinated every year, many animal experts are now changing their advice.
Over the last couple of years, the idea of vaccinating annually has gone by the wayside for most vaccinations. We've found the immunity lasts for much longer than a year. Therefore, we don't have to subject these patients to a poke and a pinch once a year.
At Kensington Veterinary Hospital, Dr. Patricia Unger says she's seen the devastating effects vaccines can have.
Can you sit? Can you sit?
At her clinic, animals get what's called a titer, a blood test that shows an animal's immunity level and whether it needs a boost. The amount of vaccine also concerns Dr. Unger. She prefers to give animals just one type of vaccination at a time.
Roll over, all the way. Yes.
It's an approach Sherry Crispin now recommends to other pet owners. After Mollie Mae's diagnosis, it took thousands of dollars and a lot of love to try to nurse her back to health.
I think that they know, you know? I think that they know when you care for them and you're willing to do anything you can, you know, to help them get better.
And now Mollie Mae is healthy and back to her old tricks once again.
Woo, dance. Good girl.
The County Veterinary Medical Association says you should still have your pets examined once a year, and then you can talk to your vet about any recommended vaccines and their risks and whether a blood test may be a good option. If it is, the test usually costs less than $50.